My name is Maria Fernandez. I am the incoming co-chair of the National Hispanic Medical Association. And I welcome you today. This is our third meeting that we've gathered here in Nevada, and I am going to do the introduction for our opening intro speaker, Dr. Jeffrey Reynoso. I will likely be doing intros and saying how big of a deal these speakers are and how amazing and grateful we are to have them. So Jeff and I go way back, Dr. Reynoso and I go way back. I did my master's in public health with Dr. Reynoso before he did his doctorate in public health. And I would like to say that he took on a lot of the programs that I was running. I was a second year and he was a first year, and then he kind of ended up leading those programs and then ended up going way above and beyond any other human in the School of Public Health has done. So he went on to be to complete his doctorate in public health and went on to be the executive director of the Latino Coalition for Healthy California. And now he casually is the Region 9 director under Secretary Becerra, Health and Human Services Secretary, and just so is really truly leading the efforts in Latino health and kind of promotion. And it is just incredible to have watched this casual takeoff of a career. And so I'm so honored to have you here, Dr. Reynoso. And I know Reno, Nevada is a small little point in your region, but we are so grateful to have you and doing our intro. Welcome.
Gracias, Maria, Doctora Fernandez. Can you all hear me? I would a thumbs up. Great. Okay. It's I wish I could be there in person, but it's been really hectic travel schedule with Secretary Becerra, my boss, and as you all know, we have an election coming up in a couple of weeks, so we are hitting the road and trying to share as much as possible the advancements that we've made under the Biden-Harris administration. So, I wanted to I do have prepared remarks, but, I see it's a small enough group that I actually am going to pass the mic on to you all first to share, name, kind of where you are in your health profession and medical journey, and maybe like one burning question or like a particular like topic that you all are interested in, and I'll try to weave that into my remarks. So handing the mic all to you for a few minutes.
Okay, so I'll start here with Dr. Diaz.
Okay, I'm Mark Diaz. I'm the chairman of the National Hispanic Health Foundation. I'm trained in family medicine, occupational medicine, and currently work for the California Public Employees Retirement System. I do have a question. It has to do with the small number of Latino physicians that exist in the country. And I know that we are working to get more Latino students accepted, but it seems like that would take a long time to make a big difference. And there are some states that are working towards reducing the barriers for Latino physicians trained outside of the US to work with the Latino community. And I'm wondering, is there somebody in the Secretary Becerra's office that is looking at that? Is there anything going on in that area?
Great. Thanks for the question. Definitely will speak on that.
Good morning, Dr. Reynoso. This is Jose Rucalon Calderon. I'm the current chair of our Nevada chapter and founder of our chapter as well, general pediatrician here in Reno. Really excited about your remarks and your time. I'm thankful for your time today as well as all the good work that you're involved in. My question is going to be a softball one, which probably is going to can dovetail into what your remarks were going to be around and what our conference is around, which is how do you see what would be the perfect pathway for people who from high school to a career in science, and including medicine, and how that reflects on, or how that can reflect on, especially for states that have significant community needs like ours, like California, where there is an overrepresentation of Latino patients with not enough people who have this similar background that can care for them. So how would you, in a perfect world, what would be your best way of being able to make something like that happen and improve?
Buenos dias, I'm Jafet Sanchez. I'm the director of the Latino Research Center at the University of Nevada, Reno. It's one of the only organizations of its kind in the entire state in terms of having a specific Latino demographic focus. And I'm going to skip the question so I can give time to our
You can ask the question. I was just saying that his was an easy question.
Oh, no, but I'm just saying it just for the sake of time, because I don't want to have every single person and then he's like, I don't have enough time. So I was just going to be generous. But if I will then, I've heard the Secretary Becerra say on several occasions that one of his almost like wishful possibilities would be for those who are struggling with having access to healthcare in terms of healthy eating and all of that, just tying it back to how much nutrition is part of one of those social determinants linking to coming from a low-income family background. And his wishful thinking has been that maybe there would be some sort of prescription or discount or something that anytime they go to the store, they now have a lower price on that fruit and vegetable that they would seek. And I just am curious to see how much that maybe has transpired into something as he moves forward and as your efforts are able to lead into something like that.
Hello, my name is Jorge Monge. I am a fourth-year medical student here at the UNR School of Medicine. Not too much of a question, really, just because it's been kind of already stated. Similar question to the sense that, I was lucky enough that I was a part of a combined degree program when I got into medical school. So that was able to give me a lot of guidance when it came to the actual application process and getting into medical school. Otherwise, I feel like it would have been very lost. So my question is very similar in the sense of any thoughts or comments or kind of plans for helping to lower the barriers that a lot of Latino and other students as well have when it comes to applying to medical school. Because when you don't have any type of medical background like I did, it was incredibly confusing and it was a tough process to get into medical school, even with the support that I had. And so kind of talking about or any thoughts about helping those students to feel more comfortable and feel like medical school is more accessible for them. Which is kind of my question as well. But thank you.
Good morning. My name is Tamara Martinez Anderson, and I serve as the Director of Admissions at the University of Nevada, Reno School of Medicine. I feel like we have engaged in a lot of efforts to support, inspire, prepare our Latino students here at the university through some programs and events. But often we focus our efforts on recruitment and limit our attention on retention. And so we find individuals who show grit and determination and motivation and are very committed to their community. But sometimes once they get to medical school, some of the support we were able to provide as pre-meds, it sometimes feels like they're just kind of thrown in with everyone without recognition, that there are still areas of unfamiliarity. And so I would love to hear a little bit more about how we can bring folks together once our students are admitted to medical school so that they are successful, don't get behind, and have kind of that similar level of support during that experience. Thank you.
Hola, Jeffrey. This is Maribus Garcia. I'm a doctor, but not that kind of doctor. So I feel a little out of place in this room. But I have my two children here with me this morning, and they're waving at you too, Jeffrey. So thank you for being here. And I think for me, it's more of just a comment. I had the opportunity to meet yourself and Secretary Becerra last year. And it was one of those moments where I'm like looking at him thinking, this man was born in Sacramento, not too far from Reno. He's the first Latino Attorney General of California. And then he goes on to be our first secretary at the United States level. It just kind of like blew my mind. And I think that I'm just so grateful for that representation. And then for you to be so open and approachable to let us feel comfortable reaching out to you when we have things that are happening here locally that we want to keep you in tune with. And I just, more than anything, just want to say thank you for all your hard work and bracing ourselves for this upcoming election. So.
Good morning. My name is Roman Urbano. I am a community health advocate for a nonprofit called ICE here at APEC. Here, I represent the Reno chapter. And my comment is very similar to Dr. Cucalon's. Since I primarily work with the K-12 population, how can we garner more interest for the underrepresentation and Latino students to want to go in a science/public health/medical career once they go into the college phase?
Hi, my name is Anna Sabura, and I'm currently in my third year of my undergraduate degree studying biochemistry, and I am pre-med at the University of UNR. My question is also kind of just a comment of what everybody else has done. I would love to see what advancements we're making for K through 12 students, especially Latino ones that are so medicine just seems like such a distant goal for them and pretty impossible. And I know without the pipeline programs that I was a part of, I would likely not be here or be capable of viewing myself as like a future doctor. So I would love to see what advancements or recommendations you would make to open the doors for them.
You're already ahead of the curve, undergrad, being at this event on a Saturday morning. So congratulations on that.
Good morning. My name is Astrid Lopez. I am a third year undergrad student majoring in public health. And I guess my question is, what are some current healthcare like change efforts that you're doing or that you plan on doing in the future?
Good morning, everybody. My name is Angel Barbosa. I am a recent graduate from UNR in kinesiology and biology, applying for medical school this cycle. I guess I kind of have a two-parter for you. Number one is mirroring what Tamara has said in terms of retention and all that. I know Nevada has programs such as the Nevada Health Service Corps, which incentivizes physicians and healthcare practitioners to stay in Nevada. I want to know if there's anything focused towards Latinos to stay in Nevada as well, or encouraging them to stay in certain areas. I know UNR itself focuses on family practice, but we do know that there's a lot of different specialties that we need here in the state. So anything towards that realm. My second one, I am myself interested in getting a dual degree in public health as well. I wanted to know realistically, and from your point of view, how much of the work you've done public health wise has influenced what Nevada policy has done in the last few years to make differences in healthcare for the state.
Hello, my name is Ricky Seha. I'm a UNR student majoring in public health onto the pre-med route.
Thank you. Okay, I think Dr. Reynoso, you got all of the people in the room, and then there are a couple of NHMA staff. But
Great. Well, really appreciate all of the comments and the questions, and I will do my best to kind of weave that into my remarks. And Dr. Fernandez, I probably have 10 minutes or so. I know we're running a little bit behind schedule, but I'll try to. Yeah. Okay. So I think going back to the introduction and kind of where I wanted to start the conversation, I have to, especially spaces like we're in right now, right? I was actually just yesterday with the secretary at UC Irvine School of Medicine. They have a program called Prime that's focused specifically, and it was created specifically focused for physicians that wanted to practice medicine within the Latino community. So it's a Prime LC program, and they were celebrating their 20th anniversary, and I got to do a fireside chat with the various cohorts for that are within the program currently. And I think we have to kind of remind ourselves sometimes that, and I remind myself that serving the first Latino HHS secretary, it's an incredible honor that I get to work for a leader that understands the needs of our community. I think many of us share, either we're immigrants ourselves or sons or daughters or grandsons, granddaughters of immigrants, and the secretary also being from the Sacramento area. His dad, when he first immigrated, was a farm worker, and so he also has that lived experience. And it really matters seeing us not only as providers, whether it's medicine, public health, dentistry, nursing, what have you, education, right? But being in these leadership positions across organizations and systems really matters, because we understand and we bring our lived experience into the conversation. So, I'm proud of serving the first Latino secretary, also being, one of only 2 Latino regional directors across the country, and being able to serve in this capacity and be able to make some changes. So I'm going to walk through a couple of the changes that we made nationally as it relates to Latino health. And I'm also really proud to serve as part of the Biden-Harris administration that happens to be the most diverse in history. And when we say diversity within the administration, it's not only diversity, racial, ethnic diversity, gender diversity, sexual orientation, disability status, first generation college students. Like, that's part of like the diversity that they were recruiting across our workforce in the administration, and also rural diversity. And I know that's important for places like Reno. There's a big rural component to the challenges in communities like Reno and other places in Nevada. So a couple of the accomplishments, because I think we're so like focused on the work and just getting the work done, we forget to take the victory laps, right? So because of the Affordable Care Act and the work that we did under this administration, over 5 million Latinos have gained access to some type of health coverage, and that's the most in history. And that's I think we think about like, how did that happen? Because the Affordable Care Act, my first job out of grad school at Berkeley, my MPH program, was a chief administrative officer in the County of San Diego Health and Human Services Agency, and I was focused on Affordable Care Act implementation at a local level in the county, and that was in 2014. So that was a decade ago. But we were able, within the Biden-Harris administration, to, for example, triple the number of Latinos within the Affordable Care Act marketplace. And you may be wondering, like, well, how did we do that? Well, let's think about like what we did. We invested the most in history at the department in our Navigator program, 100 million annually, and that's the most that our Centers for Medicare and Medicaid, CMS, has invested in this program. And as we know, with our Latino families, it's not just there's a resource. Like, we have to be able to meet community where they're at, in their language and their culture, investing in navigators and promotores, right? I think someone in the room mentioned they work with a group of promotoras. So, I think that really matters. And, if the secretary wasn't at the top and leading the department, the question could be out there: would we have invested 100 million annually in our Navigator program? A second accomplishment under Secretary Becerra, one of his signature pieces of legislation when he was a longtime congressman in the LA area, he was I believe at the time the third most senior Democrat in Congress, and he was part of the Ways and Means Committee. And one of his signature pieces of legislation I worked on was DACA. And for the secretary, immigrant health, especially expanding coverage for undocumented, is one of his passions. And under the secretary's leadership, and I would say his leadership, because it wasn't necessarily the biggest priority across, the White House and the administration, was expanding coverage for DACA recipients. So for the first time in history, DACA recipients can now sign up for coverage on the ACA marketplaces, and that's starting November 1st. So for the organizations in the room, I know some of the physicians here, you work with these populations, communities at, your federally qualified health centers. We really need all of your support to get the word out on that. A couple of other accomplishments. So focus on seniors. This has been one of President Biden's, I would say, signature achievements, the Inflation Reduction Act. And under Inflation Reduction Act, we finally got a handle on being able to lower the cost of healthcare. Because, as we know, it just doesn't matter if you have that health insurance card. It's like how much you pay out of pocket, and especially for low income folks, it can be challenging having to pay all those copays with, the cost of housing and food and what have you, just daily life. So we were able to cap the out of pocket cost of insulin per month at $35. For some seniors on Medicare, that was sometimes over $100, maybe even more than that. And so we said, no, we can't keep doing this. And in addition to that, across the board for out-of-pocket costs for prescription drugs starting this coming year, 2025, January 1st, the most anyone on Medicare with Part D, which is the drug coverage component, is $2,000. So, think about how that's going to impact, a senior with cancer or another rare disease where, they were paying tens of thousands of dollars in some cases out of pocket. Now it's going to be $2,000 across the board. And while I'm not here representing, the Harris Walls campaign, there are proposals out there, we started with Medicare, but why not all insurance coverage, right? Why not cap it? And I know there are discussions happening right on that. Another area of priority for President Biden as part of his Unity agenda is behavioral health. And I think you all as providers, even the students in the room, I think we've all felt it, right? With COVID, it just felt like, issues of mental health, especially in Latino communities, like they've exacerbated, they were always there, but they've only gotten worse. So this administration invested the most out of any administration in behavioral health care and really building up an actual behavioral health system across the country. We've invested billions with a B on expanding behavioral health. We know it's not enough, but we were able, for example, to nationalize the Suicide and Crisis Lifeline, which is now 988. So instead of calling 911 for an emergency, if it's, a moment of crisis, a behavioral health crisis, we now have 988, and we invested in all of the crisis response across the country to be able, for those 1 or 2% of calls that need immediate attention, be able to reach someone in need. Under the secretary as well, he said, with behavioral health care, it can't just be in English, right? So we were able to launch 988 also in Spanish via phone, text, and chat. We also have specialized 988 call centers for veterans, for folks that are hard of hearing, and then for the LGBTQ youth community. And, we're building them up, and we're looking at opportunities as well in other, AAPI languages, for example. I'm continuing to support that work. And then two more, and then I'll get into some of your specific questions. Caregiving. So this is another area where we wanted the Inflation Reduction Act to support more of these efforts, but within our authorities and within our current budget authorities, we were able to expand the amount of caregiving infrastructure in home and community-based care. So we know that, especially for Latino families, other communities of color, culturally, we don't send, our elders into a nursing home, for example, when they're sick, and when they need support. They're at home, but oftentimes that labor goes unpaid. So we've been able to change some of the rules in terms of payments with CMS, for example, to have kinship care, so that, as a family member that, you're taking your time off from work, or maybe you left the workforce, but now we're supporting that through Medicare, through our home and community-based healthcare services for older adults and individuals with disability. Another area where this has been another signature of the secretary, given his interest and background on environmental health and environmental justice issues. We launched within HHS the Office of Climate Change and Health, and we launched the Office of Environmental Justice. So really looking at the intersection of climate change, and we know climate change is impacting the health of our communities, from wildfire smoke to I know I don't have to tell you all, in Reno, just heat, right? And heat has an impact on our communities, especially those of our community members that work outdoors. So under the secretary, we've been able to look at efforts on protecting the health of our communities from extreme heat and wildfire smoke, and make climate change as a health issue a priority at the department. We launched, for example, a heat mapping tool for farm workers, and have a better sense of data mapping across the country, and being able to be more proactive in sharing information from CDC and other sub agencies at HHS on what level of heat is harmful to human health. So with that, we made a lot of progress, and those are the successes, right? The wins, but we know there's a lot more work to be done. And NHMA, you've been focused on this issue of Latino physicians, right? We know nationally Latinos make up a little bit over 19% of the U.S. population, but still only 6% of the health workforce. And we know that Latinos are less likely to be represented not only among physicians, but other health professions, and within STEM professions, and we have to move the needle. So kind of wanted to spend a little bit of time, and then I'll wrap it up, on one of the signature initiatives that the secretary launched, and we're starting to institutionalize at HHS, is our HHS Health Workforce Initiative. So the secretary, post COVID, when things started opening up, and the public health emergency was over, he was traveling all over the country, meeting with stakeholders. He's been in Reno, Las Vegas a number of times, and he heard, we from health plans, from hospital systems, FQHCs, we have a health workforce issue in this country, and it's across the board. I think I heard, it's not only about the training of providers, but also the recruitment and the retention of providers and the career laddering. So all of these issues need to be supported. And just like institutions like UNR, we're investing in our health workforce and ensuring that Latino communities have enough doctors, nurses, home care workers, childcare providers to be able to meet population health needs. So a little bit more about the initiative, and we've already invested quite a bit, through especially through HRSA. So this is another sub-agency of HHS. We're a really large department. It's like 90,000 people. So we have a lot of acronyms at HHS. HRSA is our Health Resources and Services Administration, and they fund our federally qualified health centers, and they fund a lot of our loan repayment programs for physicians and nurses. And through HRSA, we fund over 15 million in our minority health fellowship program. So that's another program. I think someone asked the question, what other opportunities are there? There's the National Health Service Corps. We have about 20,000 currently across the country. It's the most we've had. And we want to look at opportunities, of course, with the support of Congress. And, those conversations can be really challenging right now, depending on who's in control. But we want to continue to expand these programs if there's future budget opportunities there. I think, and then we are also investing in nurses and nurse practitioners, especially in rural areas. We actually just awarded, if it might have been this week or last week, hard to keep track of time these days, but over 100 million in our nursing and our nurse workforce that we announced. So that's out. And we're also not just looking at the direct healthcare workforce, but also funding the next, scientists and innovators in the STEM professions, because we know that that's also really critically important. The secretary under ARPA-H. So this is actually our newest sub-agency at HHS. So ARPA-H stands for Advanced Research Projects Agency for Healthcare. And under ARPA-H, we launched the Emerging Health Innovators Initiative. So we're connecting with minority serving institutions. So, historically Black colleges and universities, HSIs, Hispanic serving institutions, which I know UNR is a part of that, and developing partnerships and supporting opportunities for more Latino scientists and innovators, that want to be able to study and find the next treatment or cure for cancer, diabetes, other difficult health challenges. We want to support that earlier on in the pipeline. So let me just close out by saying that we there's a lot of work that has been done. There's a lot of work that we continue to do at the department, but we're committed to health equity. And the secretary likes to say health equity under his leadership is not going to be its own standalone thing. Oftentimes at HHS, historically, health equity has been the purview of the Office of Minority Health, and it's a small department that, to be honest, doesn't have a very large budget when you compare it to our larger sister agencies. But under the secretary, he said, no, we're going to do health equity by design. So in every conversation that we have around a policy change or regulatory change, budget priorities, we're going to think about health equity and how it's either creating more inequity or not, right? And how are we going to use all of our levers, policy levers, budget levers, to be able to get more resources to underserved communities, rural communities, communities of color, and those have been left behind, tribal communities, right? I know in Nevada it's another big issue addressing, Indian Health Service and all of the challenges within Indian country. So with that, I hope that while, I've been one of the first in my roles, and secretary definitely has, broken barriers, and been one of the first. And I know many of you in this room have been one of the first, to go to college, get that graduate degree, be in your leadership position at your institutions. It's really about these spaces where we're networking and creating a community so that we're not the last. So with that, muchísimas gracias, and turn it back to you.
Give me a second, Dr. Reynoso, thank you so much for your words. You're so inspiring. We're so honored to have you. Are there any last questions while we still have them on Zoom?
You know what? Let me just run through. I'm going to actually look at my list here. Okay, so I heard who's the right contact for health workforce. So the co-chair of the HHS Health Workforce Initiative is the Secretary's Deputy Chief of Staff. So that's Angela Ramirez. She's amazing. So if you want me to get in touch with her, or if you want to get in touch with her, connect with me or NHMA, and they'll get in touch with me. So let's connect there. And Angela, she's really looking for opportunities on. I heard there's some great programs at UNR, some great programs in Nevada that we probably have to lift at a national level in terms of their. I was just at UCI Prime, like that should be a national program, in my opinion. So are there opportunities for us to nationalize these programs, or really doing the work of supporting that Latino health professions pipeline and, other underserved communities? I also heard there was a question around food as medicine, right? This is an area where the secretary is really engaged, and the White House has also been engaged. We had the first White House conference on hunger, nutrition, and health. I think it was the first in 30 or 40 years. And as a follow-up to that, we launched a food as medicine initiative at the department. And Medicare, for example, now pays for food as medicine programs for seniors. And under Medicaid, some states have what is called a 1115 waiver. And basically, it's innovation within the Medicaid program. And some states are now funding food supports, for example. So if there's a medical need, right, for you to have access to healthy food to help with, for example, your diabetes, you're able to, as a Medicaid provider, be able to bill for that. I'm also going to put in the chat for, we actually launched a whole hub within the HHS website on food is medicine a couple weeks ago. So I'm going to put that in the chat, or you can Google like HHS food is medicine hub. And there's going to be a lot of information on our latest programs and like grant opportunities there. And sorry if I missed something, but I think we covered a lot there.
Next time we have to plan for you to come in person for 2 hours.
Yeah, definitely. Let's do it. Please invite me. Okay, good seeing everyone.
Thank you so much, Dr. Reynoso.